My name is Keith Robertson. Welcome to Talking Phat. Like, share, subscribe.
Welcome to Talking Phat. That's Phat spelled P-H-A-T, which stands for purpose, hope, and truth. This is where solutions are discussed for today's problems in our country, in our communities, and in our lives.
Peace and blessings, everyone. Peace and blessings. Rabat. Once again, I thank you for tuning in to another episode of Talking Phat. I am your host, Keith Robertson. And as you know, that's Phat, P-H-A-T, not F-A-T. And P-H-A-T is an acronym for Purpose, Hope, and Truth. Well, today we have a great show for you. Now, I always say that, but today we truly do. I'm going to introduce you to a Miss Anne-Marie Stevens, and she has come up with a cure for diabetes. Now, listen, you might say, a cure for diabetes. Yeah, you saw the title. She has a cure for diabetes, Miss Anne-Marie Stevens. And she's going to give you some information on some health benefits for those of you all that have diabetes. You know, we look at things, sometimes we call them a generational curse. No, they're not truly generational curses. It's just some things that we learned from our parents and our grandparents. And one of those things is how we eat. And so Miss Anne-Marie is going to share some information with you that can actually help save your life. And I say that, yep, that is true. And hey, Miss Anne-Marie, how are you today?
I am fantastic, and thank you so much for the opportunity to talk. I love it.
Well, listen, let me thank you for taking time out of your schedule. We really appreciate it. You know, we have a saying that there's a lot of public information out there that's not public knowledge, right? We are here to shine a light on that information, especially one of that nature that you're going to bring forth. But before we get started on WelFore Health, let's find out, who is Miss Anne-Marie?
Oh
And,
my
where did you come
gosh.
from? What's your story?
Listen, I was born in a very small village in Trinidad and Tobago. And I bring that up because I feel like my life has come full circle back to that village and back to really celebrating the life and the impact of my great grandmother. We called her Old Granny, O-L-E, Old Granny. And so in that time, she was the village healer. And she did not complete high school, but she still served as our mental therapist in the community. She delivered myself and my siblings. I'm the eldest of 5. So she was the midwife. She cooked for the whole village. I mean, she did so much for the village, including worked in our church, etc. So I left Trinidad and Tobago and studied chemical engineering, and ended up at Procter and Gamble, really leading the transition from, if anybody remembers, powder detergent. So I was that team to change powder to liquids. And of course, everybody now knows, everything as liquid detergent. Well, there was a time it was a powder, and
Absolutely.
we changed it because it damaged the lakes. That's the real reason.
Really?
Yes.
I didn't know
The
that.
phosphates in the detergent were contaminating lakes, and so that was really the big driver. Now, there were some consumer reasons, like, it would leave, back then, we washed our jeans and it would leave like white powder on jeans. Nobody
Yeah.
liked that. So there were some other reasons on the consumer end that were improved. But the big driver was really safety in the lakes.
I remember one as well. When you got the family size, that
Oh,
box
yeah.
was huge. With the big handle.
With the
Yeah.
big white handle.
Yeah.
Absolutely. Yes.
Uh-huh.
Exactly. Yep. You remember well.
Wow. That's
And
interesting.
yeah. So I'm a chemical engineer. Still really relish that analytical side of my brain. Um, but the biggest thing about my time at Procter and Gamble that I have held on to for the time since is they taught us to focus on active listening to end users or active listening to consumers. And so we were taught to identify unmet needs. So there were times when we are working on things that the consumer hasn't even realized it's a problem. I think a great example of this would be the Apple iPod. Remember when they said it's 1,000 tunes in your pocket? Well,
Yeah.
back then we had the boombox, right?
Oh
And
yeah. Oh yeah.
we cherished our CDs, right? And the
Mm-hmm.
CDs we had, like, who had the biggest,
Uh-huh.
folder to hold all the CDs,
Oh
and
yeah.
you had the ones you could tuck into the visor of your
Yeah.
car.
I remember. Oh yeah. Oh
And we
yeah.
were proud of that. We were proud of that. Who knew it was a problem, and who knew there could have been a better way? And so then Apple said, no, here's an iPod. And remember, it's the size of like a business card or smaller, and it
Mm-hmm.
fit in your pocket. And they said 1,000 tunes in your pocket. That's an
Wow.
example of what I'm talking about. So for us, when I talk to you about some of the innovation that we are bringing to the space of health and wellness,
Mm-hmm.
those are the skill sets that we are leveraging. It's that somebody doesn't necessarily say, I need this, or I want this, or I wish I had 1,000 tunes in my pocket. But
Mm-hmm.
these kinds of blue chip companies are trained, and they train us to listen a little bit differently to unmet, or sometimes we describe it as unarticulated needs.
Uh-huh. Mm-hmm.
And so, to your point, instead of accepting that if my grandmother has diabetes and my mom has it and my dad has it, that means I have it too. That is an unarticulated need because the person believes that they have to walk around with that boombox. But our
Mm-hmm.
job is to interject ourselves into that paradigm and say, no, it doesn't have to be that way. There are actually other solutions that you might be interested in.
Yeah. When I first came on, I told them that you have a cure for diabetes. I jest in that, but that is a serious need in our community. We're plagued with it in the Black community. It has
Yes,
a lot to do, I know, with our diet.
yes.
And your remedy that you've come up with, I mean, is
It's
actually common
common
sense when you
sense.
think about it.
Yes,
Yeah. Mm-hmm.
yes. It's
And
probably the biggest reason, we are having trouble getting funded because people think, wait a minute, this is so simple. But when you look at the impact in our communities, you could see that, simple or not, it is not readily available. It is not readily understood.
Mhm.
And most importantly, it is not readily employed or deployed or implemented. And
Uh-huh.
it's and we've done a ton of research, and we know that people are like, when we start talking about this, people get super excited. They're like, tell me more, I want to learn more.
Yes.
It's
Yeah.
a sense of empowerment that we gift. That's the
Mhm.
gift. The gift is, sometimes I call it like know-how, knowledge. My husband, he calls it self-efficacy. That's his favorite word. That we are
Uh-huh.
gifting, we're empowering people with knowledge and know-how. And they
Mm.
thirst for more. So it's once we start talking, because it's so common sense and because it's like, kind of things they can implement right away,
Yeah.
um, it's not so it's not so daunting.
Mhm.
And we always enjoy talking about it, our solution, because people get it.
Yeah.
And our job is to just help them live it. So the
Right.
living it is really the challenge because, it's so easy to fall off the wagon, but the living it is a big part of what we're working on.
I get it. Not many of us can actually say we aren't touched by diabetes. Even if we don't have it, we know a family member that has it, or
Exactly.
someone else that
Somebody
their family
else.
member has it.
Yes, yes,
We've
yes,
known individuals that have gone through dialysis, and
yes. It's
my wife's
devastating.
yeah, my wife's grandmother, she died from it. She was an
Wow.
amputee, and then
Yeah.
how that goes from there.
Yeah.
And my wife's mother had it, and then my wife is actually dealing with the pre-stages of it as well. So when I
Yeah.
heard about this, I was one of the people that got excited.
Yes, yes.
And so this is why I wanted to bring you forward to kind of share this information.
Yeah.
'Cause a lot of times we don't know what we don't know until we know.
That's exactly what it is. Well, one of the challenges is so many schools got rid of home economics.
Mm-hmm.
Just like they got rid of PE or gym or whatever they called it, fitness. They got
Yeah.
rid of that, just like they got rid of music.
Yeah. Yeah.
And so
Mm-hmm.
when you look at our society right now, you're seeing that you actually reap what you sow. And in
Right.
this case, it's public policy, right?
Mm-hmm.
So by getting rid of home economics, we aren't really introducing people to like how to boil eggs anymore, or how to shop cost effectively anymore,
Mm-hmm.
or how to think about nutrition. I like the word nourishment. So we aren't really being taught how to nourish our bodies from the inside out. Um, and so a big part of what we are doing is kind of filling in that knowledge gap that
Mm-hmm.
was missed because the programming is no longer available in school.
Mm. Yeah, the program. Yeah, they're
Exactly.
programming them now just it's like you eat, but you don't eat to live. Like you said, it's
Correct.
not nourishment, it's just
It's not
filling. What
nourishment.
fills
It's
you?
just
You were
caloric
hungry,
intake.
now let
Yeah,
me put something in that
exactly.
place. So now you're
Exactly.
no longer hungry, but it's food, there's
Exactly.
no nourishment in that.
Exactly. And so, listen, I feel, first of all, that word nourishing is a very hard word. I've talked to people about it, to consumers, because I've wanted to introduce it into our program. And so it's a word that is unfamiliar. And so I have to use it judiciously, but you just really defined it very, very well. A lot of times we eat and we are filled
Mm-hmm.
and we are satisfied with the caloric intake, the calories.
Mm-hmm.
It's
Mm-hmm.
filling. We feel full. And when we're full, we feel great. But the nourishment, the
Mm-hmm.
foods are sometimes nutrient deficient and
Yes.
therefore not very nourishing. So they keep you alive, but you're not maximizing the nourishment that you could get from your
Mm-hmm.
food.
Yeah. And we are what we eat, right?
We definitely are.
Yeah. So I would like for you to expand a little more about WelFore Health, and let's talk about your program.
All right, so I'm going to share my screen and fingers
Okay.
crossed that the gerbils are not out.
Okay, great.
Okay, and so you're able to see that.
I am.
Okay, great. So this is what we've been talking about, WelFore Health. My husband and I, his name is Ed Stevens, and as mentioned, my name is Anne Marie Stevens. And so we're on a mission. That's what's really key about our program. We're not like the next best app. We're not the next best fad diet. We are not any of those things. What we are is a lifestyle intervention. And as Keith mentioned, we are focused on really trying to save lives. That's what we're all about.
Yes.
But as a mission, our mission is to break the intergenerational cycle of diet-related diseases among multi-ethnic families. And I just want everyone to just stop and really try to internalize what we're saying here. What we're saying is that many other programs, competitors, they focus on weight loss. Or, so they may focus on, oh, you have a class reunion coming up, you want to drop a dress size, or you want an inch off of your belt, or whatever.
Mm-hmm.
You get that as a side effect of our program, but it's not our primary intent. Our primary intent is to give each of you the skills, the language, the vocabulary, the know-how, the insights to pass it on to your children and your grandchildren and other friends, the people that you love in your life. This is not like a self-centered individual program that we're working on. We're working on a family lifestyle intervention. And that's incredible and really important because We want to break the cycle. The fact that mom has it, dad has it, absolutely does not need to mean that you have it too. That is what we're trying to change. And it might be, some of us might say, well, it's too late for me. Okay, fine. If you believe that, okay. But it's not too late for your children, or it might not be too late for a friend. So it's an each one teach one kind of thing. And in our community, we believe that that approach really matters. So here is some data. And every time I see this, it breaks my heart. And so there's no surprise, right, that multi-ethnic communities are disproportionately impacted by type 2 diabetes. As Keith mentioned, each of us, most of us, we know someone. If it's not ourselves, it's somebody else. We know of at least one person. By the way, Ed and I got into this because our families are impacted by type 2 diabetes. This is why it's this and not just weight loss. So it's this and not necessarily heart disease or stroke yet. But for us, type 2 diabetes is in our family DNA. And so we ourselves are at high risk. I mean, it just is. That's just the way it is. And so we have to be very proactive about making sure that in our family tree, we break the cycle ourselves. So we're not talking to you about anything that's like a side hustle or hobby. I mean, this stuff is real to us. But here's the thing, right? People with obesity are 80 times more likely to develop type 2 diabetes. That's 80. Okay. And then, yeah, it's huge. And then this is a big number, which is a lifespan reduction. It's a loss of 20 years. So sometimes you hear people throw a phrase out, well, health is wealth. And we're like, what the heck are they talking about? Health is wealth. This is what it means when we talk about health as well. So if you lose on average 20 years of your lifespan, you have lost 20 years of earning power. You have lost the opportunity to save or to leave more wealth for your family when you do die a more natural death. You have lost just so much. Think about all those family memories and food memories, and there is so much in this number. So I would say if you remember, if anyone listening remembers anything else, they should. I mean, there are lots of things to remember, but really, this is a big number. Even the 80, you can forget about the 80, but the average loss of your lifespan, average lifespan loss of 20 years is very significant. And that's versus like peers. Okay. So
Could you go back to that slide?
yes, sir. Absolutely.
I want them to see that though. 20 years.
20 years, 2 decades.
What is the average life
80.
for a man is what? It's 78 and
Yeah.
woman is 80, 82
Yeah.
or something like that.
So
20
that's like
years.
those are like this is like peers, exactly.
Wow.
So on average, when we have, let's say, untreated type 2 diabetes, or when it becomes exacerbated, the average loss versus those numbers you just recited, 820, 78, 82, you lose on average. In our communities, on average, it's a 20-year loss.
Wow, that is that's scary. When you I mean
It's
when you see the
staggering.
numbers,
It's
that's
staggering.
scary.
It's
Wow.
staggering. It's
Yes.
staggering. It's staggering. And so this is why we put this first. And so when you apply the things we teach you in our program, you do lose weight. But you could see why we are not fixated on weight. We're fixated on, hold on, we're fixated on let us control this type 2 diabetes epidemic. Just let us wrap our arms around this and cut the cord, because it's really hurting us. It's hurting our life average, our average life. It's hurting our ability to build wealth. It's hurting our ability to be there for the other generations. it is really hurting us in a significant and meaningful way. This is not just like, can we afford insulin? This is like 20 years of your life.
Yeah. Wow. That I didn't realize it was that severe.
Yeah,
I
yeah, yeah.
do have an
It's huge.
understanding of diabetes, and
Yeah,
I know individuals that have suffered loss, but when you see it in black and white,
yeah,
it's eye-opening.
yeah,
I,
yeah. It's staggering.
mm,
Yeah, it's staggering. So this is what we're working on. And this is why we would like to partner with whomever wants to partner with us, because this is the crux of the issue.
yes.
Okay, so obviously grandma has it, grandpa has it, mom has it, dad has it, brother has it, sister has it, whatever. You think, okay, but there will be some of those people in that kind of genetic pattern. Some people, yeah, will have some predisposition, but most of us, no.
Mhm.
Most of us, no. So there are tons of studies done. You can see here, Tufts University, well known, American Medical Association, well known, Blue Cross Blue Shield, well known. And they all land on a slightly different angle to the same thing, which is many diet-related diseases, such as type 2 diabetes, can be prevented with optimal nutrition.
Mm.
Okay. This is that nourishment conversation we were just having. So
Mhm.
you could say optimal nourishment or optimal nutrition. The problem is not that we don't know this. The problem is that in many of our communities, and especially in underserved communities, these kinds of programs and solutions are not, not executed at scale. And when
Right.
I say at scale, I mean to impact our masses.
Mhm.
We might do a study and maybe 10 out of 100 of us might have access. But if you want to address the 20 years, 100 out of 100 have to have access. Now, out of the 100, 10 may decide not to try it or do it or live it. 20 might decide not to do it, live it, try it, whatever. But the point is around access.
Mm.
Everyone should have access, and then you can make a choice as to whether
Mm.
you want to do it or not do it. But
Yes.
this is an access problem. And
Wow.
so we are not going to be able to address all of the access points, but we are going to push as far as we can. And as I mentioned, partner with whomever we can to try to maximize how many of the 100 will have access to optimal nourishment.
We can do it together. That's
Well,
for sure.
absolutely,
Mhm.
absolutely. It's going to take all of us doing a part of this together. So this is WelFore Health. This is we call it a, a hybrid platform. So we'll talk about like a web app. Sometimes in shorthand speaker, you might hear somebody say, oh, you're working on that app. We see it as a platform
Mhm.
because it's both hands-on and technology, health tech. So yeah, we do have like an app we're working on, but we, you're gonna eat from a plate.
That's
And
right.
when you go to Cheesecake Factory, I need to know that you know how to eat off of that plate. Or
Mhm.
when you go to a party at a friend's house, I need to know that you know how to eat off of that plate.
Wow.
Wherever you are, the China buffet, I need to know that you know how to eat at the China buffet. And that's what our program is about. That's the lifestyle skills that I'm talking about.
Mhm.
We want to re-educate your eyes. We eat with our eyes. We want to re-educate your brain, your stomach. And it's not going to happen overnight, the things I'm talking about.
Sure.
But that is really the end game. The end game is you have that self-efficacy to self-manage in whatever circumstance you're in, to always okay, 80% of the times you're going to focus on optimal nourishment for your life and your circumstances. So if you're a basketball player, you're not going to eat like the person who is, at a desk job, let's say, at a library. Those are two different kind of jobs, and the optimal definition of optimal nourishment is going to be different in those two different circumstances.
Absolutely.
So one of the things we learned in our communities, we have to start with foods. We have to start with foods. And what does this mean? So we don't start with what's your weight goal. We don't start there. We start with what's your favorite food. Because if you tell me your favorite food, like you eat fried chicken, if you tell me you eat fried chicken 5 days a week, then I know I have to work with you on fried chicken. And
Sure.
it's not even that you're not gonna have fried chicken, but I'm gonna say, have you tried oven fried chicken? Have you tried air frying your chicken? Have you tried not breading your chicken? Have you tried? I'm gonna work with you to figure out what is a healthier way for you to continue to enjoy fried chicken where it tastes like fried, but it may not be fried. Or I might suggest that you change to olive oil instead of another oil. Or I might suggest our job is to just make suggestions so that you can continue to enjoy the foods that you love. Now, fried chicken 5 days a week is probably not that healthy. So then we're gonna say, okay, fine, you can start at 5 days, but then in a week, I'd like for you to get to 4 days and then try fried fish, or something like that. So that's when we talk about learning about what are your favorite foods and how can we work with you to reimagine those foods. So I'll share it in a moment. In fact, I'll share it now. We created a line of salt-free spice blends. Because one of the other challenges, we call it a comorbidity. It's a big word to just say that people with diabetes tend also be a little bit more predisposed to like high blood pressure and other diet-related diseases like that over time. Or it could be that some people start with high blood pressure and then they, kind of morph into other disease states. But I told you already, I'm from Trinidad and Tobago. So we love great tasting food. So the idea of just eating iceberg lettuce as a way to be nourished is not a thing for us. We want collard greens. We want, baked chicken, I'll say. We want some fish, but we want flavor. This is a smoky jerk blend. It has 0 salt, 0 sugar. And people love this. But that's an example of when we say reimagine heritage food. So I might say, hey,
let me ask you that. So your spices and things like that, are they in stores yet, or is that one of the goals? Or
that is one of the goals. We are aggressively figuring out how to get that into stores.
Okay.
Yes, absolutely. And it's all about that, helping people have confidence that they don't have to give up favorite foods. They don't have to give up favorite flavors. They can still enjoy great meals with their families. When we first started doing diabetes research, we spoke to a woman who really influenced my way of thinking about this a lot. And she said, I hate not being able to eat like the rest of my family.
Wow.
That's what she said. She said, I have to eat off of this special plate, and my family gets to eat off of this other plate. And I feel, like a lot of times she actually does not want to eat with her family. And so for that reason, we created, I don't know if you can see it.
Yeah, we're gonna have to once we stop the screen share, I want to see the spices as well as the plate. That plate is one of the things that really caught my eye.
All right.
Yeah.
So we teach you how to reimagine your heritage foods. So collard greens or whatever, okra, whatever, we don't really care. Sweet potatoes is a big one. And so we have our line of spice blends. We have suggestions. We have, tips and tricks around how to continue to enjoy your favorite foods healthier. And then we teach you how to shop differently, how to prep. A lot of times people believe that healthy eating is really expensive. You have to go to Whole Foods. it takes a long time. My kids are going to hate me. I'm going to waste money. There are all those beliefs. And our job is to say, you know what? We do a cooking class. Everything we use in the cooking class comes from Walmart. You don't have to buy into that belief that if it doesn't say organic, it isn't healthy. That is not true. We don't have to buy into the belief that if you go to the farmer's market and you buy whatever is on sale, or the cheapest thing there, it's not healthy. That is not true. You don't have to believe that it takes a whole day of cooking to make, like, stir-fried cabbage and some rice and some baked oven air-fried chicken,
Uh-huh.
with a piece of fresh fruit. Boom, I just did it. That's a healthy meal.
Mm-hmm.
And that takes 30 minutes or less. So we have to break some of our belief systems here in this start with the food step. And then snacking. We did some research, and snacking, we were pleasantly surprised at how many people understood that part of their kind of weakness, if I want to call it that, or their challenging moment is with snacking, that they were struggling with how to snack in a healthy way. So we obviously provide solutions there, but we also at some point would like to create a line of healthy snacks.
Uh-huh.
So that start with the foods. And then we also have in our premium programming, remote monitoring. This is where we have people use cloud-based body weight scales, cloud-based blood pressure units,
Mm-hmm.
and we're able to track their trends over time, and we can give them feedback on progress, or they have gotten stuck and how to become unstuck. So that's what that
So
is.
what exactly is that though when you say a cloud-based
So it's a blood pressure meter,
mm-hmm.
and you don't have to personally record the numbers. So you just put it on and it records in the cloud.
Oh, okay.
And
Okay.
then
So you
on
can
the
keep
body
track
weight
of it. I got
scale,
it. Mm-hmm.
you step on it and it's recorded to your profile in the cloud.
Mm.
It's
Okay.
100% secure, HIPAA compliant,
Uh-huh.
and we use that to just monitor progress.
Okay.
Um,
Yeah,
and then,
people are lazy a lot
I
of times. So,
mean,
yeah,
yeah,
take that
yeah.
away. You don't even have to write that down.
Don't write
We're
it
gonna keep
down.
track of it for you.
Exactly,
Mm-hmm.
exactly. Yeah, because everything, the more steps it takes, it's more friction. It's a decision. Oh my God, I have to do this. I have to do that. So our job is to reduce the friction towards living a healthier lifestyle. That's what this is. And then, one of the really important thing, there's a ton of research on this, is
Mm-hmm.
online, not necessarily online, but having support
Oh, yes, yes.
and knowing you're
Yeah.
not by yourself, that
Mm-hmm.
something is wrong with you or whatever that negative energy is,
Mm-hmm.
it needs to go away. Because that is not what this is about. This is about, we are, one of my favorite visuals is we're going through a door, but we have to go through the keyhole. And
Mm-hmm.
so your shoulders get stuck once in a while, or you need somebody to pull you through or
Uh-huh.
something. That's what it is. But then when you get to the other side, you can return the favor to somebody on the other side of the door.
I believe community is real important as well.
Yeah,
A bad team will beat one good man anytime.
absolutely. Yeah,
Yeah.
yeah, you cannot do it alone. And
Wow.
then this is our technology. So we're
Mm-hmm.
doing using artificial intelligence to really help with that whole, how do we set this up so everyone has access. And oh, by
Mm-hmm.
the way, we're doing this as a web app. Now, when I say it's a web app, the reason why that is important is you don't have to have an Apple phone, you don't have to have an Android phone. You can access it from any device in the library, in the
Mm-hmm.
community center, at school, in a hospital, whatever room,
Mm-hmm.
any device. You can just log into a URL and boom, log
You
in
there.
and you're in. So
Removing excuses. Love it. Removing
that's it.
excuses. You don't
That's
have
it.
an excuse. Yeah, that's right.
That's it. Yeah. Well,
Mm-hmm.
I don't have that phone. Well, I don't know how to download the app. Well, it takes up too much bandwidth. Well, no, it's all gone. It's a web app.
Oh, wow, that's great.
Yeah, yeah. And so again, we have another company that we started over 10 years ago called Precise Portions. And that brand is the brand where we develop most of our portion control tools
Mm-hmm.
for adults, for children, at home, on the go. This line has already been in 2 clinical trials in the UK, um, and published. So the studies really show that the evidence proves that these things are very, 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 very effective.
Sure. Because
Um,
when I saw that and you explained, in each of the areas of the plate, right? You have three
yeah,
areas in the plate, and what
yeah,
actually went in
yeah,
those areas. I
yeah.
know the first thing I said was that, we like to put the meat in the big section,
Listen,
you know?
it's so tempting, right? And it's
Yeah.
like T-bone steak. The T-bone is always nudging out the
Oh my God.
veggies, you
Yeah.
know?
Yeah. Hey, Garrett, we talking about you eating that 20-ounce steak, man.
Yeah.
Yeah.
And the key is you can have a 20-ounce steak in a day, but you
Mm-hmm.
just shouldn't have it in one sitting.
Mm. Okay.
So that's what we talk about, like reimagining your favorite
Uh-huh.
foods. So if the joy is I love steak, okay, fine. But we just want you to cut that thing in half or cut it in thirds and have some at this meal, some at this meal, some at this meal. And at the end of the day, you'll have had 20 ounces, but your body would prefer not to have it all at once.
I'm sure. Yeah. Yeah.
Yeah,
I know mine would. Wow.
yeah.
So in other words, we're teaching people how to eat again.
Oh
We've
my
been
gosh,
out here
that's
and
pretty insightful,
yeah.
actually, because your emphasis on the word eat is really provocative because yeah,
Mm-hmm.
we are teaching people how to eat again. Oh my God, that's
Because
pretty
a lot of
powerful.
times, just like in the finance, we don't say a budget. I say a spending plan.
Yeah,
No one wants the budget, but everybody
right.
likes to spend. So you have a
Yeah,
spending plan. So yeah.
yeah.
So now you're giving people a eating plan versus
Correct. I love that
yeah.
actually.
Hmm.
I may have to steal
Versus
that,
the
Keith.
diet.
Yeah, no, nobody wants a different.
Hmm.
Nobody. And plus the diet is a word that has been misused and abused. It used to be that a diet meant healthy, optimal nourishment.
Mm-hmm.
But because we've had so many fad diets and yo-yo diet and keto diet and this other diet and the grapefruit diet and the liquid
Mm-hmm.
diet, because we have so many words connected to diet, when we say diet, people are confused and they think it's a short-term event as opposed to a lifetime of eating
Yes.
optimally, right?
Yeah.
And
Yeah, eating optimally. Yeah. I love that.
yeah, and
Yeah.
that's what we're
Mhm.
doing. We're trying to say, yes, you should enjoy eating again. And oh, by the way, you should have confidence that what you're eating is really nourishing your body, and you should create new food memories, and you should make this like a part of a happy, healthy life.
Yes. We have to once again begin to live. We've been in survival mode for so long. People are
Hmm.
caught up in the rat race and not really paying attention to their life. But
Correct.
when you see that, just by your changing the way you eat can
Yeah.
actually add 20 years onto your life.
Can you believe that?
Wow. Mm.
I mean, that what I have never put a summation statement like the way you just did, but that is it.
Yeah. Yeah.
It's like just changing the way you eat can add 20 years. I mean,
Yeah.
it takes the food away from that caloric, let me just be full, to
Yeah.
being more intentional
Mhm.
about recapturing your own 20 years. It's yours.
Yeah. Yeah, we pick up all these bad food habits. I remember one time my wife and I, we had gone to a restaurant and when the food came, I looked at it. I'm like, man, this is all we get. It's never gonna fill me up. That's what I'm thinking. I look at her, I'm like, they got small portions here. And as I began to eat, and when I got finished, I was full.
Wow.
And it caused me to realize that a lot of times I eat because it's there, not because I
Right.
need it, but because it's there.
Yeah. Well, and building on that, it's that clean your plate, you don't
Mm-hmm.
know where that next meal is coming
But
from, right?
we talk about that generational thing, right? Clean your plate before you get up. My grandma
Exactly.
used to say, "Hey, eat all
Yeah,
that food. I'm not throwing food away. There's power plate up
exactly.
here." And
Exactly.
yeah,
Exactly. Yeah,
wow.
exactly. So hold on. I think I might just, oh, yeah. So then the last thing I would like to share is our long-term goal. So we talked
Mhm,
about this lifestyle impact we want to create. We talked about giving access to more and more people in our community by setting this up, building this out as a web app platform.
mhm,
But in terms of our long-term goal, like not just this quick diet mentality, but
mhm,
we are really focused on productivity, that health is wealth thing. So when you are at work, we want you to not have to be absent so often because
mhm.
your toes hurt or your head hurts or this
Yeah.
hurts or that hurts. And then we also want to improve your productivity. And so the reason why these two are different, uh, when you're at work and you're present and you're engaged, you improve your productivity, you improve your output, you improve your impact,
Mhm.
you are present. And that we feel is significant. And
Yes.
then, of course, this is when you're at home and you're in bed or you have to take pills or whatever.
Mhm.
And then the counter to that is hospital costs, just medical costs. So this is more on the hospital side, reducing medical costs per patient. And this pertains to patients with type 2 diabetes who have to be hospitalized because of some neuropathy, or there is just some issue that's out of control. And then reducing rehospitalization is the hospital releases you, but again they give you some meds, they don't tell you how to change how you eat,
Mhm.
they don't give you enough of those life skills to change your default setting. So you go back home and there is that sweet potato with the brown sugar and the
Yeah.
marshmallows. And it's
Mhm.
like calling your name. It's like, welcome home. We're so glad you're home. Here is a
Uh-huh.
baked potato, sweet potato with marshmallows, and I
Mhm.
am being extreme, right? But anyway, so this is really the overall impact that we would like to have
Yeah,
long
you're not
term.
being extreme because that is true. In all that you're talking about, what has come, couple things came to me. When you said innovation, what problem are you solving? It is to the point. It's spot on. The problem, and I think a problem with a lot of people too is the willpower.
Oh my
And
goodness.
this will actually help with the willpower,
Yeah, yeah,
by automating a lot of it,
yeah,
and
yeah,
then having the community to have them held accountable,
yeah,
and then showing them how to again eat,
yeah,
reteaching nourishment to them. Because
exactly.
I hadn't thought about it, but you're to the point, but you're right. We had home ec in school that did teach us that, if you didn't get
Absolutely.
it at home, you got it at school. But
Exactly.
if you're not getting it at home, you're definitely not getting it at school now. So
No. Okay, so I'm gonna stop share now.
okay. And
And
let's show that plate again in the spices. Let's
well,
see that.
yeah.
Yeah. Yeah,
Okay,
close
so
up. There it
okay,
is, right
there.
there. Yeah.
Yeah.
Uh-huh.
Okay.
So what goes in each section of that plate there?
All right. So in the top half, it's non-starchy vegetables.
Mm-hmm.
And then in this lower, what is that? Lower left is your non starchy veggies.
Mm-hmm.
So that would include things like the potato,
Yep.
or corn and things like
Mm-hmm.
that. And then on this side of the plate, it's protein. So it could be meat or plant-based,
Mm-hmm.
or whatever. But yeah. Now, normally you get kind of two servings, and we give examples, and everything we sell um, has some nutrition education with it. And so
Okay.
we give examples. So when we say, plant-based, here's what that means. When we talk
Mm-hmm.
about non-starchy, I'm sorry, starchy veggies, here's what that means. We also recommend, this is just best science, fruit with every meal. Now, a lot of
Uh-huh.
people who have diabetes, they tend to think, oh, I don't really need fruit because it's sweet. And it's when you have more than one serving, it becomes problematic.
Right.
Or when the meal is not well proportioned,
Mm-hmm.
that's when you run into challenges. But if it's well proportioned, like a half of the plate non-starchy veggies, then you can have one serving of fruit. And then, of course, we also recommend like a calcium based either beverage or yogurt or some way to get that calcium intake, especially, well, we all need it. I mean, we sometimes say, well, women need it more. Truly, for balance, nourishment, everybody needs calcium. And then we talk here about healthy oils. But what is we actually created this plate in two versions. So
Uh-huh.
you have like a retraining plate, and then you have a maintenance plate.
Ah, okay. So
So
do
we
they
go
come
to,
in packs or how do they come?
yeah. You know, uh, we have these in packs. We have unpacked them, but I think we're going to repack them so that
Mm-hmm.
it's like that. And then our vision is that we'd like to see this as a system, and it's
Mm-hmm.
going to be called the WelFore Waste System, and it will have a couple of our salt-free spice blends.
Mm-hmm.
These blends also come with like recipes.
Ah,
So there's
uh-huh.
like, here's fries, sweet potato fries. So again, if you love sweet potato, this is a healthier way to really continue to enjoy sweet potatoes. And then, we have like green and so on. So yeah, we see the system as having a couple of our spice blends, a couple of the portion control plates, some nutrition education, of course, a cookbook,
Mm-hmm.
and the a QR code for the web app. So that is the thing that we're working on.
That's great. One of the things that I really like because a lot of people believe that if you eat healthy, like you said before, it doesn't have any flavor to it.
Right.
And we love flavor.
We
We love
love, I mean,
flavor
we're not going to
in
give
the
up on
culture.
that. That
Yeah.
is not happening. Right.
We have to have flavor.
We got to have
Right.
it. We're not giving that up. Right.
Yeah. But
Right.
I tell you, I really want as many people as possible to go to the website and do their research. We're going to put that information down below. Make sure we have your contact information as you want to provide, and reach out and ask questions. Because again, a lot of times public information is not public knowledge, and we're giving it to you now. Who knew that by retraining yourself how to eat could actually add 20 years to your life? That's a big number. That is a
Yeah.
big number.
Yeah.
Yeah, I wish I could go back 20 years.
It's not too late. It's really not too late.
Yeah.
That great grandmama I mentioned, she lived to be 94.
Oh, wow. Full life. So, is there anything else you want to add in
Yeah,
closing
I
before I
sure
go to the
do.
song?
I would be remiss to not let the audience know that we are in the middle of a clinical trial of this subject funded by the American Diabetes Association and in partnership with EVMS. So we encourage everyone to reach out and to see whether it's something you might be interested in participating in. No drugs. This is only lifestyle kind of tips, tricks, best practices, everything we
Mhm.
just talked about, at no cost. So please contact Jordan Pettaway at email diabetesresearch@evms.edu. Diabetes research at evms.edu. and our contact name is Jordan Pettaway. And tell her I sent you. Anne Marie sent you.
Yeah. Do it for your family. You know,
Do
do it
it
for
for
your
you.
children,
Do it
your
for those 20
children's children.
years, man.
Yeah.
Let's
Yeah.
do it for 20 years.
Absolutely. Well, hey, listen, Miss Anne Marie, we're coming to a part of our podcast here where we call this a prerequisite to coming on. Have to bring what we call the sauce. And you guys know what the sauce is, right? It's some information that you've learned through life experiences or work or wherever it came. But it's some information you can share with the people that they can put into practice as soon as they get off of this podcast. What say ye, Miss Anne Marie? What is your sauce?
Goodness. Attitude. Attitude is my sauce. You know, life knocks you in so many unexpected ways. And it knocks us all down at different times. And to me, the ability to get up, dust off, it doesn't really matter how ugly it looks or how dirty it feels or whatever, but you have to get up. And I think the big reward comes to those of us that can get up, dust it off, and keep moving forward. That's, I cannot tell you, just for me, that's critical. Now, let me just add this. A big part of your ability to dust off and kind of move on to see another day is who are those people in your life? Like, are they pulling you down and helping you stay down, or are they helping you dust off and keep moving forward? And so there are times where you do have to kind of reassess. Is this person helping me move forward, or is this person helping me stay down? But at the end of the day, it all depends on you. It depends on me to just have an attitude that's like, you know, life is just not going to keep me down. I'm going to keep moving forward.
Oh, that is awesome. That is awesome. I feel the same way. I do. I feel the same way. I call it Kim. People say, Kim, I say, yeah, keep it moving.
Keep it moving. Absolutely.
K-I-M.
Keep it
Yes,
moving.
yeah.
Keep it moving. Yeah, because when you
Attitude.
get stuck, it's the worst thing.
Yeah, keep that vibration up. Don't operate in that lower vibration, feeling sad for yourself, feeling down. It has to be something to make you smile and laugh sometimes,
And
y'all. Laugh sometimes.
Absolutely. 1,000%. You gotta
going.
laugh. You gotta laugh. You just have to laugh. Yeah.
Absolutely. I bet your grandma laughed, didn't she?
Oh
Did
gosh, yes. Oh, but can I tell you about this woman? She
Sure.
smoked a pipe.
Did she?
She smoked a pipe, yeah. And lives to be 94. Oh,
94. Wow. That is awesome. That's great. I tell you. Well, listen, Miss Anne Marie, I really thank you for your time today and sharing this information with us. You know, as I stated in the beginning, you know, you are saving lives, because I really truly believe that this will save a lot of lives. We just get an understanding of what we can do to help not only ourselves, but our children and our children's children get an understanding, even more so than about just nutrition, but how we eat.
Yes.
You know, it's just so important, you know, and we can stop those generational curses with information.
Yes.
Yes. Well, we thank you for coming on the show today, and look forward to having you again and hearing more about you. But I can promise you this, that we're going to support you.
We
We're
really
going to
appreciate
support
that
you
more than I can say. Yes. Yes.
and see how we can help spread this word as well. You know? Well, guys, once again, let me thank you for tuning in to another episode of Talking Phat. And you know, when we know better, we can do better, because action of knowledge leads to power. I'll see you next time. Peace.
Thank you for taking time to tune in to Talking Phat. As we know better, we must do better, because action of knowledge leads to power. If this content has been useful to you, please like like, and share. Tune in again. Peace and blessings.
Hey, I am Anne-Marie Stevens, and our company name is WelFore Health, and I have just been talking fat.